Assalamu alaikum wa rahmatullah. Hello, everyone, and welcome to the second lecture on the base of the skull. Today we'll explore the anterior, middle, and posterior cranial fossae, examining their general features, foramina, and the structures passed through them. Moreover, we'll study the cervical vertebrae. Understanding this crucial topic will help you to grasp the anatomical and clinical knowledge as well related to the base of the skull. So let's begin. Yep. We'll start by looking into the cranial cavity. As you see here, this is the cranial cavity. Inside here, this is the cranial cavity, and the cranial cavity it has a cap. Okay, in this cap is made of the bones that, if you remember, we have the frontal bone anteriorly here, we have two parietal bones, and in the back we have the posterior bone. So these bones form the cranial cavity, okay, or skull cap. And the base, we'll study the base in detail through this lecture, but would like to have a closer look to what are the structures that are found inside the cranial cavity, inside here. And here mainly we have the brain with the different brain loops. We have the brain stem, cerebellum, deep here in this fossa, and we have dural sinuses. We have dura, falx cerebri, and antitorium cerebelli, and falx cerebelli as well. Okay, and we also have blood vessels. So let us just quickly look to the falx cerebri. This is the falx cerebri, and the falx cerebri and tentorial cerebelli, both of them are important dural folds that provide structural support to the brain. The falx cerebri looks like a crescent, as you see here. Okay, it has anterior attachment to some structures that we'll see in minutes, like crista galli and attached posteriorly to the tentorium cerebelli itself. Okay, it is found between the two loops of the brain, the right loops and the left loops. The second one is the tentorium cerebelli, and the tentorium cerebelli is horizontal dural fold that separate the cerebellum from the cerebrum. Above here, there is the cerebrum, the occipital loop, and below here we have the cerebellum. Okay, we have tentorial notch, this opening here, and this tentorial notch allow the passage of the brain stem, which is midbrain, pons, and medulla oblongata. Okay, so as you hear, this is the second component of the cranial cavity, which is the base of the brain. And as you see, the base of the brain is made of three fossae: anterior cranial fossa, anteriorly here, the middle cranial fossa in the middle, and the posterior cranial fossa. So what are these fossae? These fossae are depressions in the floor of the cranial cavity that houses and protect different parts of the brain. So here, this is a site of the frontal loop. Here, this is a site of temporal loop, and here, this is a site of cerebellum, brain stem, and on the top of the tentorium cerebelli, you have the occipital loop. Okay, each of these fossae has distinct features, foramina, as you see here, lots of foramina, through which critical structures pass. So let us start studying the anterior cranial fossa, which is found here and as well here. Always, all the time, try to look to this completed base of the skull. Okay, completely articulated base of the skull. So here this is the anterior cranial fossa, and this is a closer look for this section. So the anterior cranial fossa is the most anterior part of the cranial base. It's formed by frontal bone. Yeah, this is a frontal bone. Ethmoid bone in the middle here is a green color, and um, the lesser wings of sphenoid bone. So three bones. We have frontal bone, we have ethmoid bone, and we have lesser wing of sphenoid bone. This fossa mainly accommodate the frontal lobe of the brain, the frontal lobe of the brain. Okay, let us study the different foramina and the structures passing through these foramina. So anterior here we have the frontal crest, and this frontal crest uh, act as attachment for pars cerebri. Posterior to it we have a foramen here, and this foramen is called foramen cecum. And the foramen cecum provide venous communication between the mucosa of the nose and the superior sagittal sinus. Okay. Then in the back here we have the crista galli in the middle, and this crista galli also acts as attachment for pars cerebri. On the sides here we have lots of openings, as you see. These openings are called cribriform billet of ethmoid bone, and these openings allow the passage of the olfactory nerve, which is the first cranial nerve. Okay? And the olfactory bulb also lie here in this area, as you will see later on. Okay, and if you go in the back here, okay, we have the anterior clinoid process, right and left, and these clinoid processes acts for attachment of the tentorium cerebelli, for attachment of tentorium cerebelli. Okay, sorry. Now let's go and study the middle cranial fossa. Here, this is the middle cranial fossa, and as you see, it is the deeper, more deeper than the central or anterior cranial fossa, and it formed primarily by the two sphenoid, the sphenoid bone. This is a sphenoid bone here, and as well the temporal bone. This is a temporal bone in the back here. Okay, it mainly, as I said, houses the temporal lobe of the brain. Temporal lobe of the brain. Okay, let us study the structures and the foramina and the structures that passes through these foramina in the middle cranial fossa, and we start by the sella turcica, okay, which is here. The sella turcica houses the pituitary gland. Pituitary gland, a very important master gland actually for all the endocrine system in the body. Okay. Then we have the chiasmatic sulcus, which is anterior to the pituitary fossa here, and this is mainly for the optic chiasma, which is the decussation of the optic nerve, the second cranial nerve. More anterior and lateral here, we'll see the two openings, the optic canal openings, and these openings for the passage of the optic nerve, which is the second cranial nerve, actually coming from the eyes. Okay, more laterally, and this fissure or opening, big opening that connects the middle cranial fossa with both eyes. This is called superior orbital fissure. The superior orbital fissure uh, allow the passage of very important cranial nerves, actually four cranial nerves. Three of them are the oculomotor nerve, trochlear nerve, and abducent. Oculomotor, this is the third cranial nerve. Uh, trochlear, the fourth, and the abducent is the sixth cranial nerve. Okay, these cranial nerves supply muscles of the eye, and as well it allows the passage of the ophthalmic division of the trigeminal nerve, which is the first division for the trigeminal nerve, the fifth cranial nerve actually. Okay, Not only that, but also this opening allows the passage of the ophthalmic vessels. Ophthalmic vessels, okay? Now, if you go a little bit back here, this opening is called foramen rotundum, here and here. And the foramen rotundum actually allows the passage of the second division of the maxillary nerve, okay? The second division of the trigeminal nerve, sorry, which is the maxillary nerve, okay? So here, the maxillary nerve pass more posterior and lateral. This opening here is called foramen ovale. It looks like the ovum, and the foramen ovale actually allow the passage of the third division of the trigeminal nerve, which is mandibular nerve. Okay, mandibular nerve. More posterior lateral, as you see here, small foramina. These foramina are called foramen spinosum. Okay, the foramen spinosum is mainly for uh, the medial meningeal artery or vessels, medial meningeal vessels. Okay, when we go back a little bit here, we'll find the foramen lacerum, and this foramen actually is closed throughout life by a cartilage. Okay, it's not opening, but the carotid artery, which is coming here from the carotid canal, will come from the neck through the carotid canal. It will lie on the foramen lacerum after it is closed. Okay, so it will pass and come here and then ascend upward. It has a different pathway that we will see later on when we talk about the blood supply of the brain. Okay, let us explore the posterior cranial fossa, which is here. This is the posterior cranial fossa, and this is the most posterior and the most deepest part of the cranial fossa in general. And it is mainly formed by the occipital bone, with this blue color here, and a portion of uh, temporal bone. So here, this is the temporal bone, okay? Small portion of temporal bone. And this fossa mainly houses the cerebellum and the brain stem, especially midbrain, bones, and medulla oblongata. Okay? Okay, let us study the foramina that are found in the posterior cranial fossa and the structures that pass through this foramina. So the key foramina in the posterior cranial fossa include the foramen magnum. Is here the biggest actually foramen in the base of the skull in general. And this foramen magnum is mainly for the passage of the spinal cord, accessory cranial nerve, which is cranial nerve number 11, and as well vertebral vessels, arteries, and vein. Then more laterally here we have sorry, here let's study this because it is closer to the foramen magnum. This is a hypoglossal canal. The hypoglossal canal is for the passage of the hypoglossal nerve, which is the 12 cranial nerves. Okay? Then when we go to the outside here, we'll find the jugular foramen, and the jugular foramen mainly for the passage of glossopharyngeal nerve, cranial nerve number 9, vagus nerve, cranial nerve number 10, and accessory cranial nerve, which is cranial nerve number 12. So we'll find accessory cranial nerve here and as well here, and we'll talk about this later on, why it comes here and then it also go through this foramen. But not only that, this foramen also allow for the passage of the internal jugular vein. Internal jugular vein. That's why it is called jugular foramen. Okay. More laterally here and here we have opening in the vitreous part of temporal bone. This opening is called internal acoustic meatus. Okay? Internal acoustic meatus allow the passage of the facial nerve, the seventh cranial nerve, the vestibulocochlear nerve, which is the eighth cranial nerve, and labyrinthine vessels, labyrinthine artery and vein. So these are all the structures passing through. But you also need to know the grooves here. You need to remember this groove for the transverse sinus, and we here have other group for the sigmoid sinus. Okay, and I think we talk about this from our side. This is the internal occipital protuberance, which is opposite to the external occipital protuberance in the occipital bone when we look at it from outside. Okay, last time we kept studying this part of the brain, which is the inferior surface of the skull. And just to make it easier, it looks like a little bit difficult and complicated, but to make it easier, again, it is divided into three. Okay, so we have anterior part, we have middle part, as you'll see here, and then we have posterior part. Okay, so to make it easier and to understand this stuff, let us start by the anterior part. Anterior part or anterior aspect of the skull is divided uh, actually uh, is made of the alveolar arch. We call this alveolar arch, and the hard palate. Here, this is a hard palate. So the anterior part is made of the alveolar arch and the hard palate. So the alveolar arch is actually made of the maxilla bone. If you remember how it looks like from the front, the maxilla extend downward to form the axillary arch, the alveolar arch, which accommodate the upper jaw teeth. Okay, and the hard palate is made of also two sets of bones. We have the maxilla again, which extending downward and backward from the most of the hard palate bone. This is the maxilla bone, and we also have the palatine bones, two palatine bones here. Okay, so the maxilla and hard palatine bones in the back. Okay, we have important opening here, which is incisive foramen. We look at it in minutes. Uh, we talk about it that it allows communication. No, it allow actual communication between the passage of arteries and veins between the roof of the mouth and the nose. Okay, and we have two foramen here, which are greater palatine and lesser palatine foramen. Okay, so this is the anterior part of the base of the skull. Alveolar arch, hard palate. That's it. Okay, let us study now the medial part. The middle part of the base of the skull is formed by the greater wings of the sphenoid bone. Here, these are the greater wings with yellow color. This is one wing, and here, this is the other wing of the sphenoid bone with yellow color. And the vitreous part. This is the vitreous part. It looks like the foot or the legs of the sphenoid bone. And we also have the styloid bone, which is here, and the temporal bone, the vitreous part of temporal bone, okay, and the styloid process of the temporal bone. So in general, the middle part of the base of the skull is made of sphenoid bone, vitreous part of sphenoid bone, wings of sphenoid bone, and the temporal bone. Okay, the main features of the medial part or middle part of the base of the skull are you have the pterygoid plates here, medial pterygoid plate and lateral pterygoid plate. These are very important. Okay, and we have pterygoid fossa, which is here in the middle between the two pterygoid plates. We have the foramen ovale, which is found here, and here. Foramen ovale, the same foramen that we study in the middle cranial fossa, and posterolateral to it, which is here very small opening, and this is the foramen spinosum. Okay, And as you can see here, here and here, this is foramen lastrum. Okay, so these are the foramina that you can see from below in the base of the skull. Okay, so in the middle part, ovale, spinosum, and lacerum. Okay, and we can also see here the posterior nasal opening or nasal aperture. Okay, the posterior nasal opening or nasal aperture. Okay, uh, now let us study the posterior part of the base of the skull, which is mainly made of occipital bone. This occipital bone here, it's a big bone, okay? And then we also have the mastoid bones or the mastoid part of the temporal bone. The main features of the posterior part of the base of the skull, we have the foramen magnum, which is here, and you know what the structure is passing through, spinal cord, vertebral vessels, and the accessory cranial nerve. We have the occipital condyles, which are here, this one and this one, and these are very important for forming joints with the atlas, which is the first cervical vertebra. Okay, and this joint is very important for the movement of the neck, responsible for the nodding movement of the neck. We also have the hypoglossal canal here and here, passive hypoglossal nerve. We have the jugular foramen. This is a jugular foramen here and here. Okay. And we have the styloid process here, and this is a mastoid. Between them, there is an opening called stylomastoid foramen. This stylomastoid foramen is important for the passage of the facial nerve, the seventh cranial nerve. Okay. Again, this is another picture showing the different structures, mainly the foramina. Foramen ovale, foramen spinosum, jugular foramen, carotid canal for the passage of the internal carotid artery, stylomastoid foramen, foramen magnum, okay, here foramen lastrum, and so on and so forth. Lastly, we'll have a look for the cervical vertebra, and the cervical spine actually consists of 7 cervical vertebrae starting from C1 to C7. C1, C2, and C7 are considered as atypical vertebrae, okay? But the rest from 3, 4, 5, and 6, these are typical vertebrae. So, in general, the cervical vertebrae are characterized by being smaller, the smallest vertebrae in the body, and because of that, they allow a wide range of movement or greater motion in the skull in the body compared to other sections of the spine. Each cervical vertebra share certain characteristics such as a small vertebral body here. This is a main characteristic of cervical vertebrae. Then a triangular transverse opening in the transverse process, and this is mainly for the passage of vertebral vessels, artery and vein. Okay, and they are also sharing this feature, which is bifid spine. The spine process of the cervical vertebra is divided uh, and is bifid. Okay, so small vertebral body, transverse foramina in the transverse process, and bifid cervical spine. So these are the main features of all typical vertebrae. Okay, but as we said, the seventh, which is here, is atypical because it has long spine, and this spine is not bifid. This is why the seventh cervical vertebra is not typical vertebra. Okay, then in the next slide, let's study C1 and C2 and identify why they are atypical vertebrae. As you see here, this is C1, okay, and this is C2. So C1, also known as atlas, it is a ring shape and lack both body, which is supposed to be here, and spine, which is supposed to be here. So it has no body and it has no spine, or spinous process. Uh, it, is, it supports the skull and form atlanto-occipital joint. We talk about it uh, in a minute, okay? So here, this is atlas and the occipit, which is occipital bone. Here, they form a joint which is called atlanto-occipital joint. And this joint is very important for nodding motion of the head, as I mentioned earlier. Okay. Then C2, it has transverse foramen like the C1. It has a spine, and this spine is bifid. So this is not the case why it is not typical. It is atypical because it contains this structure here, upward projection called dens or odontoid process. Okay. This dense or odontoid process serve as a pivot joint with the atlas, which is the first vertebra. So as you see here, they form a joint, and this joint is also very important. It's called atlanto-axial joint. Atlanto-axial joint, and it permitting the rotational movement of the head during turning from one side to the other side. Okay. Then thank you so much for your attendance and see you in the next presentation. Bye.